welcome to another episode of Talking Points with Preferred Health Magazine. Today's special guest is Dr. Norman Shealy. Dr. Norman Shealy is a pioneer of holistic pain management with more than 60 years in his field. He has helped more than 30,000 patients worldwide find relief from their chronic pain. Let's tune into the show and listen in on the great advice he has to share. Hi, Dr. Shealy. Welcome to the show today. How are you this morning?
Wonderful. Thank you. You too, I hope.
Yes, absolutely. Having a great day. I'm very excited to speak with you today. You've had some career. Let me tell you, let me run this down and tell me if I have all the numbers correct, okay? So I have you as the father of holistic medicine with more than 60 years in your field. You've treated more than 30,000 patients.
Yes.
You're the author of 312 scientific publications.
Now up to 350, I think.
350, my goodness. 36 books.
Now 40.
40 and 14 patents.
Yes.
All right. And you're said to be putting the heel in healthcare. And I really love that quote right there. It sounds wonderful to me. As a neurosurgeon, let's start in the beginning. What got you started in holistic pain management as opposed to conventional medicine? Why was that so important to you?
Well, when I was in my residency, we treated chronic pain by cutting the front half of the spinal cord with a razor blade.
Oh, gosh.
I thought it was the most barbarian thing I'd ever seen. So when I finished my residency, I spent 3 years studying physiology of pain and came up with transcutaneous electrical nerve stimulation and spinal cord stimulation. Then I was getting 400 patients a year sent for me for the spinal cord stimulator, sort of pacemaker. I wouldn't operate on 92% of them because they had been operated 4 to 5 times and were on Valium and Percodan.
Okay.
I didn't know how to get him off Valium and Percodan. I decided somebody had to find an alternative. So I started with behavior modification. And then all of a sudden, I learned about autogenic training and biofeedback and spiritual healing, and I was transformed myself.
And that's right. Now, you are known for treating the whole patient, whether that be physically and mentally and spiritually. I do want to talk about the fact that you are the inventor of the TENS unit, which is the Transcutaneous Electrical Nerve Stimulation, like you mentioned, which is used worldwide for pain management. I myself have actually had that treatment done many years ago for a pulled muscle.
Great.
And the fact that you are the inventor of that and everyone uses that as a standard form of treatment for pain, muscle, pain. What can you tell me about the invention of that and how that came to be for you?
Well, when I was doing the physiology of pain, I had to play with stopping the pain electrically in the animal. And I found that applying electricity to certain points on the body would relieve the pain. And so, interestingly, when I introduced that to neurosurgeons, they said, "You're an idiot. All you did was try it on animals." But 2 years later, when I presented the results on spinal cord stimulation, everybody in the room wanted to do it. And so that's how it got started.
I mean, what an accomplishment in itself. I mean, to be the person who created that is phenomenal. I did want to also say, what can you tell me? You've had so many inventions. Can you tell us a little bit more about your journey as an inventor? You started with the TENS. Was that the first of its kind?
Yeah. Yes.
And did that kind of send you down this road of coming up with this alternative for pain management and finding different inventions that would help as opposed to, like what you say, the numbing of medication?
Oh, yes. I already was questioning the use of narcotics and mood drugs. I consider them at the top of the list of bad drugs.
Yes, and I agree with you on that as well. There's so many people, especially with the epidemic in the world nowadays, that are hooked on these pain pills.
Right.
What would you say to that, to what's going on, in the world, with the world being the way it is, and these doctors writing these prescriptions and, calling it a day?
Well, I say the conventional medicine is stupid and ineffective and dangerous chronically. It should be used only in acute situations.
Right, because chronic situations, that's where where it comes in, where people become addicted to those medications, correct?
And it's not only for pain, it's for depression, anxiety, chronic disease of hypertension. Using 3 antihypertensive drugs, you have a 44% chance of controlling hypertension and a 100% chance of becoming chronically fatigued and impotent. I can control hypertension 99% of the time safely.
Wow, that's wonderful news. Now, why do you think this kind of education isn't a part of every physician's training?
I call it the pharmacomafia.
Oh, I agree.
I consider the pharmaceutical industry as dangerous to your health as the mafia is to your money.
No, sadly enough, but you're absolutely right in both regards.
Interestingly, when I first discovered holism, I was invited to lecture to students about TENS and these kinds of things. And I found that fully over 70% of the medical students the first year were interested. By the time that came to the 4th year, it was 10%. By the time they finished their residency, it's 1%. They've been brainwashed for 4 to 10 years.
To believe that that was the only way of treatment.
Yes.
I feel like it's coming around, though. I feel like, this whole alternative, holistic approach to medicine is making a huge impact in the last maybe 10 years, I would say. You see people trying to really search for that alternative in every way, whether it be physical ailments or for mental health. What do you make of that?
Interestingly, the establishment has done everything it can to destroy the word. They've changed it originally to alternative and complementary, and then to integrative. And integrative is often a farce.
Okay. Tell me what.
A hospital locally bragged that it had an integrative medicine department. They offered hot stone massage. Now, I'm not opposed to hot stone massage, but it's hardly comprehensive.
Yeah. And let's talk about that. I mean, you speak about biogenics and autogenics. Let's talk about more of that. What does that mean? And explain to us what that is.
In 1972, I learned about autogenic training at a meeting I was at and biofeedback. It was so impressive with my patients who had failed conventional medicine that I went back to school and got a PhD in psychology, humanistic psychology, by the way.
Okay.
And my dissertation was published for the public in a slightly altered form, 90 Days to Self-Health, in which I discussed this discovery of biogenics. Now that is 68 different biogenics exercises.
That was your first book, correct? The 90
Yes.
days?
Well, actually, it was my second book. But the first one had nothing to do with medicine.
Okay. Oh, interesting. Now that second book, though, sold over 130,000 copies.
Yes.
Worldwide. Did you feel at the time that, oh, hey, people are listening, people are paying attention, people are, seeking this? This is
well,
important.
I was pleased in those days, but the media has changed immensely. I had a lot of exposure spontaneously. The media today is bad at pharmacomafia.
They're number two, right? As far as getting the right information out there to people,
Yes.
I would say.
Yes.
I agree. Would you say that you believe holistic medicine in today's atmosphere should almost be primary treatment?
I absolutely agree. I think every physician needs to know the alternatives to drugs, because every drug in the world is worse in the long run than the disease it's treating.
Now, you've said also, people come to you when they've failed conventional medicine. I love this saying because it should be the other way around. You're right. It should be the first, form of treatment is to seek that, holistic approach. But, I was speaking to, I think it was Dr. Bruce Perrier. Okay. He's an author of a book about, he's a neuroscientist, and the book was written in conjunction with Oprah. And he did speak about how important genetics is in your health.
Oh, phenomenal. If you are born as a wanted child and treated and nurtured in the first 18 years of life, you're likely to be healthy until 50s or later. But the average life expectancy is only 79 in this country. Our telomeres, the tips of our DNA at birth, shrink if you're healthy 1% a year. But the average person dies at 79 because of obesity and smoking and drug use and inappropriate behavior in general. The average is 79.
What would you say to doctors, when a patient comes into the office, how important it is to have that family history?
Absolutely critical.
But on a different level, not just, was there, a heart disease in your family, but on the psychological side as well. What would you say to that?
Well, were you growing up loved?
That should be the question.
I often say I was over-nurtured. I have a mother and a father who, well, for instance, my father was a football fan. My best friend in high school was a quarterback on a football team. But my father would not let me go out for football because he was afraid it could harm my skull, brain, and spine.
He was probably right.
When I was 16, going away to college, he said, Norman, if you will not smoke or drink until you're 21, I'll give you $1,000. And he did. He couldn't have paid me $10,000 to smoke.
So it worked though. So I mean, being over-nurtured, I think, and the whole process of talking about, family history more in depth right off the bat when you walk into the doctor's office should be, just as simple as checking off those boxes. It should be spoken about. And this, I think, is
on my mother's side of the family, 90 to 102 was normal.
Oh.
But on my father's side of the family, 5 of 6 brothers died between 48 and 54 because they smoked. Brother number 6 lived to be 80 without smoking.
Well, I mean, those are statistically speaking, it's amazing, but your genetics seem to be prominent there also with the 90s. How old are you right now, Dr. Shealy? If you don't mind me asking.
89 and 4 months.
Oh, congratulations. Happy birthday. That's wonderful. It's wonderful. So you have the good genes, right? You've learned your lessons.
I hope so.
So now, where do you see yourself going? What is the next step? Actually, let's track back. I do want to talk about what I've heard was your favorite invention, which is the PEMF device.
Yes, I consider our gamma PEMF better than all the psychiatrists, psychologists, and mood drugs in the world.
Tell me why. That sounds pretty high up there. Tell me why that is.
Well, first of all, we've cured 10 narcotic addicts for 4 years.
Wow. Tell me how it works. What is it good for? So we obviously know addiction now, but what is this good for? I saw the apparatus, which we'll put on the screen for everyone to see, but tell me how this works.
Well, I had an intuition 30 years ago that we must relate to earth energy. The earth energy is 7.8 hertz, plus or minus 2, because everybody's, not that stable.
Oh,
But
okay.
do you know what chakras are?
I do know what the chakras are, right?
Well, there's 7 chakras in the body.
Mm-hmm.
And of course, the soul goes to 8. But if you measure 7.8 by 7, the top chakra is 7 times 7.8 plus or minus 2. And this is what our gadget puts out. That's the general sweep. Every 10 minutes, it sweeps your entire flock of frequencies. And that takes 10 or 20 minutes to put your brain into that frequency.
What's happening at that frequency?
Well, gamma frequency was first discovered in Buddhist monks who meditate 8 hours a day. And so when I found that just the general sweep would put you in gamma, I then put you into upper gamma, period. And that makes the brain light up with red gamma immediately.
Wow. Is that putting you're in a state of kind of the cellular Goldilocks state?
Peace.
Peace.
Peace. I call it detachment.
Oh, that sounds good. Sometimes we need
if
that.
you don't like something and you can't change it, there's no value in wasting your time wallowing in manure. And I am so glad that I learned detachment in 1972. In today's world, especially, who cares if I can't change it? I can't change any government whatsoever or any media whatsoever. So I detach. I'm at peace.
Peace. And that's
Now,
good for, I think, a lot of people's mental health. I often say, if you need to know about the news, get your 15 minutes, 20 minutes for the day and be done.
yes.
And just find your peace and your joy in the life that you're living.
Absolutely. So the first thing I do, let's say it's sunny now and start inhaling. Oh, who cares? Nothing I can do about that. And it's true of 90% or more of the things that come your way. But only 2.5% of Americans, there's huge studies that show that 97.5% of people have 1 to 5 unhealthy habits. They lack common sense. In fact, one of my books is called Restore Common Sense.
I love it. That's great. I'm going to pick that up and hand it out to a few.
But the number one cause of premature death now is obesity.
Right.
72% of Americans are overweight and 36% are fat.
Crack me up. No, you're right. That's like the epidemic number 2, diabetes, overweight issue in the world. But let's talk about this device. So tell me, so it puts us in this state, right? In this the state of the highest chakra. And
I'm sitting on it now.
Really? So this is the device, and that's what you do. You just stick it on your head and you leave it there for, would you say 20 minutes?
Well, for people who have anxiety,
Okay.
I start them at 2 hours a day.
Wow.
But you can sleep with it on your pillow and get the same benefit.
Unbelievable. And this is obviously safe to use.
The only contraindication is a pacemaker.
Okay.
It won't hurt you, but it would harm the
The electric.
pacemaker.
Mhm.
And I don't recommend it in pregnancy because I'm not willing to do research in pregnancy.
Right. Okay. So now this is, you just leave on your head. Would you be able to use it for other areas of your body, or is it
Oh,
on your
yes.
head is where it's just completing?
No. When you put it over your chest, it will reduce blood pressure within 20 minutes.
Wow.
If you put it over your chest, I have brought people with lung disease from oxygen saturation of 75% to 95% within 30 minutes or less.
Oh my God, this is amazing.
If you put it over an area of pain, or whatever, you can put it over your leg,
Shoulder.
anywhere on the body, you've converted to the delta frequency, which is one of the three frequencies it puts out. It puts out the sweep of chakras, pure gamma or delta, and it put it on the delta, and it relieves pain as well as the TENS device.
Wow. I mean, I need to get my hands on that invention. That's available on your website. Is that correct?
Yes. And right now there's a $200 discount for a special occasion.
Okay, that sounds great. I will definitely make that offer to all of our viewers here, if you don't mind. Also, I wanted to ask you, is there an age discrepancy as far as using this device?
I have used it on a 2-year-old
Wow.
with intractable epilepsy, not controlled by drugs.
Oh my gosh.
Right here in my office, this is a hyperactive child. He fell asleep within 20 minutes.
Unbelievable.
So I use it on epileptics even. And my favorite story of all is a man with Parkinsonism, so severe, he could not speak and he could not stand with few people holding my arms. Using it at home, in 1 month, he walked into the clinic and could talk.
Come on. That's amazing. This is a miracle. Why isn't this invention on every doctor's website, every chiropractic, pain management website for treatment?
Only the smart ones.
Yes, obviously, yes. So now it says here, it promotes healing, reduces anxiety, helps, I guess, promote bone health,
Yes.
endorphins, pain relief, better sleep, human
Definitely.
growth, secretion, more energy, better oxygenation, oxygenation and circulation, improves immunity as well.
Absolutely. It reduces C-reactive protein,
Okay. Tell us
which
about
is
that.
an inflammation monitor, if you will, but the best monitor. Or hemoglobin A1C, even pre-diabetes,
Right.
up to frank diabetic neuropathy. I have reversed diabetic neuropathy where people have numb feet.
Wow.
With the device.
Does it come with a kind of an instruction, I hope, like, if you're dealing with a certain ailment, how long to keep it on and where to put it at as far as the gamma or delta?
Yes.
Does it come with all that instruction?
Yes.
And is this something you can use safely every day, or is this
well, I've been using it for over 5 years.
Every day?
Prophylactically.
That's amazing. And I heard also nerve and tissue regeneration. So that was something
Yes.
we were speaking about too. It's an amazing invention, and we'll put up more information about that on our website for all to see as well. Now, I mean, such a great time talking with you. So impressive. Your career and what you are doing for your patients and people who are seeking treatment is unmatched.
Yeah, I want to emphasize that the purpose in life is to help other people. Person who made these glasses, these scissors, is as important as I am, in my opinion, because I could not make the shirt if you, I wouldn't know how to do it. But, you know, everything. So if you do, the person who painted this room is important, because I couldn't do what I did do if I tried to do everything.
For us, that's right. You can never be, you know, an expert at all things, but we're so happy that you're an expert in this section, in this sector, most importantly.
Well, it's interesting. At age 4, I announced to my family, I don't know why, I want to be a physician. At age 16, when I was finished high school and met to go to college, I knew I wanted to be a neurosurgeon because I was so interested in the brain.
And there were no influences or mentors along the way at that young age.
No.
Just a curiosity.
Well, it's the same of all my inventions and things. I call it a download. I just get an idea and work on it.
Maybe that's your special gift from above, right?
Oh, no question about it.
Now you do have a book also where you say, I think it's called Conversations with G.
And G is a guide.
Okay, and tell us more about that book. Is that your latest book I've seen?
Actually, the latest is Restore Common Sense, but it's my favorite book.
Okay.
Because it tells my story in as great detail as I can tell it. And I think it was December of 1984, I suddenly heard a voice. And it was a male voice. And a lot of my information has come from him over the years. And he'll say, Norman, you need to think about this. Really? He doesn't give me details most of the time, but he starts me on a chore.
That's wonderful. I do believe in that as well. I do believe we're all somehow guided by a higher spirit.
Oh, no. By the way, at the core, we are a spirit. The spirit has a soul. The soul incarnates to gain wisdom.
Absolutely. That's wonderful. Now, what about the future of, Shealy Soren Wellness Institute? What's the situation there? I know Dr. Soren, we couldn't speak to him today, but we'd love to have him on the show eventually. Tell me how he's also helping you continue this experience.
Well, I looked for years for a partner. You know, I was maturing in age, and I wanted somebody to carry my own way. I interviewed 100 physicians whom I turned down.
Wow.
Wrong personality. 6 years ago, 7 years ago now, whoa, time passes. In May, it'll be 7 years. I walked into a meeting and he was a co-speaker, and I recognized him from our life together as with St. Francis of Assisi.
Oh my goodness.
I've known for over 30 years that I was with Francis of Assisi. And I have met 2 other brothers from the time. And in June of 2015, we went to May or June. We went to Assisi and spent a week. It was like heaven. I mean, I felt absolutely at home. 3 days later, I went to this meeting in Kansas City, and I walked in and Sergey was speaking. And I recognized him as the 4th of the closest friends with St. Francis. I walked up to a man I'd never seen before. His wife is quoted and said, I think I just lost my husband. but she and I are now friends as well. So I introduced him to the concept off stage and invited him to come and visit, and then I knew he was the soul brother I wanted as a partner.
Like that you said, that the soul brother that you wanted as a partner, and he had his own experience, which we'll get him on the show for sure to go over that actually led him during his, to his holistic journey.
Yes.
As well. So we'll speak to him on that another time. But As far as you're concerned, I mean, 60 years in your field, you've had such a wonderful career and helped so many people. What do you see the future of holistic medicine? Where do you see this going?
Well, continuing the broad field of energy medicine. Everything's energy.
Right.
The communication is energy, but our food determines that energy. Our thinking determines our energy. And the gadgets I developed and the mental concept of biogenics all affect our energy. Interestingly, if you have good health habits, all of them, then you should live 100 years. And I've known since I was 12 years of age that I should live past 100. My great-great-great-grandfather, I met when he was in his 90s.
Wow.
His daughter, my great-grandmother, lived to be 102.
Oh, God bless.
And so when I read the diary of my great-great-grandfather when I was 12 years old, I said, as I finished reading that, well, I should live past 100.
As long as you do the right thing, right?
I just had a woman yesterday come in for another experiment. We're checking the EEG in response to certain music. To see the music calms. Good music calms the brain as well. But she already has improved significantly using the PEMF device every day.
So wait, so you're now using the PEMF device in relation to music? Is that what you mean? Is that what you said?
Well, yes, but music in itself can heal.
In itself can heal. We're not talking about hard rock. We're talking about classical, or are we talking about anything that makes you happy?
I wouldn't say hard rock is good, but soft rock is good.
Something just enjoyable and not so stressful.
Yes, if it makes you want to dance, and
yes,
it's good music.
Right. So now she
went into deep, deep delta, which is just prior to falling asleep.
Wow. That's fun. So that's something you're pursuing now, this kind of testing as well?
Yes.
And what about the future? So this is the future here. We're talking, this is something new that you're doing?
My next experiment
is
going to be what I call the rejuvatins.
Rejuvatins.
The gigatins, the 52 to 78 billion cycle per second. One electrode in your head and one on your sacrum. I believe that using that for an hour a day will regrow your telomeres. It's a device that puts out human DNA frequency, which is 52 to 78 billion cycles a second. Lower frequency is good, but they're not ideal for correlating, normalizing your DNA. And so I know that it relieves depression, for instance, and anxiety. It produces, helps the brain produce serotonin and endorphin. But now I'm going to try measuring your telomeres before and after 6 months of daily use for an hour.
Okay, so we'll find that out. Maybe we'll speak about that in a few months. Such a pleasure speaking with you today, Dr. Shealy. We're going to continue this conversation of holistic pain management and your inventions, and we'll be sure to share this message with all of our followers and all of our readers coming up, especially in the new June edition coming out this summer.
Wonderful. Thank you so much. It's a pleasure talking to you.
Very good. We'll speak to you shortly. Have a great day and enjoy the rest of your time.
Wonderful. Thank you so much. Blessings.
Thanks again for tuning in to Talking Points with Preferred Health magazine. And a big thank you to patient preferred neuroscientist, Dr. Norman Shealy, for coming on the show today and sharing his wonderful invention, the PEMF device, as well as the journey of his career and how he's helped several thousands deal with their pain management. Okay, until the next show, be well and live in gratitude.